Hey guys, Lauren Losing here for my B12 injection video. I'm going to go over all the things that you will need, and then I will also talk you through where you can do your injection, and I'm going to talk through the process before I do it, or maybe I'll just do it as I do it. I'll probably talk it through before and after. Okay, so things that you need. Obviously, you need your vial of B12. Comes with a little plastic flip-off cap on it. It's a little baby vial. So I just have a 1 ml vial. If you can get more, it's easier because you have your whole, the whole dose is 1 ml, so to get all of this out, it can take a little bit of finagling with the needle, and so that can take a little bit of practice. I've been in nursing school and doing these kind of things since I was 20, and I'm not saying that it takes 8 years to get a whole hang of it, but I'm just saying try not to get frustrated. And yeah, I'll get into a couple of other things with that. Okay, other things you will need. You need to wash your hands before, obviously. I do not use gloves personally, but you can. They don't need to be sterile gloves, they just need to be clean. And then either rubbing alcohol and little cotton swabs, or gauze, or you can just do the alcohol wipes. I just didn't have any left. Okay, and then you need your needle or your syringe. Your doctor, there are varying sizes for syringes. Excuse me. Yes, there are varying sizes for syringes. They're probably going to give you a 3 ml syringe because those are the intramuscular injection syringes, and that's where you're getting this injection, is into your muscle. But the sizes of the needles vary. They could give you anywhere from a 5/8 of an inch needle up to a 1.5 inch needle. Majority of the needles that I have, excuse me, are an inch long. They actually prescribed me the smallest needle, but that's not the one I use. I probably could, but I feel a little bit better using a longer needle, just making sure that it's getting into muscle, because when I give it to myself, I give it to myself on my leg. It's just the easiest place. You could also, if you're having someone else administer it, you can have it in your arm or in your butt if you want. But the easiest place to inject yourself is your leg, so that's what I'm going to go through with you guys. So the gauge of the needle is the thickness of the needle. You can request a 25 gauge needle because the B12 that you draw up is actually a really thin liquid. Some injections are thicker, so they're super hard to draw up in a smaller needle. The standard IM injection needle is 1.5 inches and 23 gauge. So that's most likely what you have gotten when you've gotten any kind of muscular injection. The needle that I use is a 25 gauge and 1 inch. But then I also actually I don't have any 23 gauges. I have a 21 gauge and 1 inch, which is a lot thicker. So it might be a little bit scarier for people. It's still not that bad. Okay. So I'm going to talk you through it first, and then I will stand up and show you on my leg. I'm trying not to make this too long. So you are going to take your syringe out of the package. Actually, let me do this as I talk you through it. I'll take a little less time. Okay. Taking my syringe out of the package. It just peels up in this way. Make sure your needle is on tight because you don't want to be drawing up your solution and then have it come out the side. Okay. This is a new needle. This is a sterile needle. Okay. Do not touch the needle. But this is what it looks like. Okay. It looks a lot bigger on screen. That is only 1 inch long. And it's really thin. You can put this aside, the cap. If you were in a regular situation, you never recap a needle, but okay. You're going to pop this off. Since this is a one-time vial, you don't need to wipe it with alcohol on top. If you are using a vial that has more than one dose, after the first dose, you need to wipe it off with alcohol or an alcohol wipe. Okay, so first, you are going to draw up exactly the amount that you need in your needle. So draw it up to 1 ml. I actually tend to draw up a little bit more just because I'll explain why in a minute. So what you're doing is you're injecting, so you're putting it into this rubber end, and then you inject the air into the vial. If you don't inject the air, you're not going to be able to pull out the fluid. So if you inject a little more air, it's just sometimes easier to pull out the fluid. So you can see the needle. This is a red solution, so it looks a little creepy. It kind of looks like blood. And then once you feel like you've gotten it all out, put it back in a little bit and then push it up, back up to the 1. Okay. You're going to see a little dripping out right now. Okay. You might have an air bubble in there. If you have an air bubble in there, you just flick it like that, and the air bubble will go to the top. Don't feel like you need to express that air bubble. Because it's just a little tiny thing. Okay. So this is where I'm going to stand up, and you're obviously not going to be able to see my face, but you will hear my voice. So I'm going to recap my needle for a second because I'm going to put it down. Okay. Please excuse like the fleece diaper that I'm wearing. Basically, I'm wearing a fleece booty shorts. Okay. So, looking at your thigh, you want to cut it in half this way. Okay? And then you're looking at the outer portion of your thigh. So obviously either one. So in half this way, out this way. And then you cut it into thirds. So 1, 2. So 1, 2, 3. You want to get it in that middle third. So outer aspect, middle third. Let me sit down for you. Okay. So now you want to clean it off with either your alcohol wipe or your rubbing alcohol. When you inject into your leg, this is only for intramuscular. This is injecting into your arm, your leg, your butt, anywhere. But for this purpose, your leg. You want to it's difficult with this solution because it's red, but you want to retract the plunger a little bit, because if you pull back and you get blood, you want to pull your needle out. This has never ever happened to me, but you don't want to inject into any vein or artery or anything like that. So you pull back on the plunger a little bit. If there's no blood, then you inject it. If you inject it slowly, or, you know, don't just push it in there, because that's what causes pain. But if you do get blood, you just pull it out. You can still use the same needle. You just rub it down again with alcohol, put it back in, pull it back, and okay, so the key to no pain is doing it fast. Needle in fast, solution in slow, needle out fast. Okay? So, I'm going to do it. Alright, no blood. So, it's going in slowly. And then pull out. Some needles, if you push on the end, the actual needle will retract. This one isn't a retractable needle, so I just recap it. And you're all set. So, as you can see, no problem, no pain. So, I hope that video was helpful. I hope for anyone who was scared out there of doing it yourself, that it showed how easy it is and how non-painful it is. And it's just a much easier way for me to get in my B12. So, alright guys, I will see you on Saturday sessions.